Today is Thursday, April 21st, 2020, 7 o'clock. We're at the National Palace in Mexico. We're going to start our daily press conference on the COVID situation caused by the coronavirus. We're going to focus on two parts. First is our daily technical report by Dr. Jose Luis. And the second part is we're going to present a new tool to you for people who think that they might see people who are suspect cases for COVID. Now we're going to have another person here to moderate our session. Doctor, please go ahead. Good afternoon, everyone. We're going to get started with our update on what's going on internationally and in Mexico. We've been seeing this image for quite a while, so I think you're familiar with it. We've gone down 1 percentage point to 45.6. It used to be at 47%, which was representing people who had started showing symptoms, especially over the last 2 weeks. This is how we're seeing how the pandemic is behaving in different countries. Now, we haven't seen much movement here between the Americas and Europe, but we can see that the Americas have increased a little. There has been more of a concentration of cases. So we have 45.6% there. Next slide. Here we can see 3 different pieces of information. These have to do with confirmed cases, confirmed in a laboratory. The first are the accumulated cases. This is starting from Mexico's first confirmed positive laboratory test. So we have 9,501 confirmed today. Now, also the information from yesterday, this is coming from there, of course. And here we're having a little bit more of a focus. We talked about those 9,501 confirmed cases. And these are the cases, as I said, that were showing evidence, they're showing symptoms in the last 2 weeks. And of course, those were confirmed by a laboratory, and these represent the active epidemic in Mexico. And our database shows that period of activity. Now, these people could still be transmitting the disease if we don't continue to take actions on this, if people don't continue to stay home, or people aren't taking biosecurity measures. For example, if they have been attended in the second or third levels, then they might continue to be transmitting the disease, and therefore it would still be active in our country. Now, as another piece of information, this information has been confirmed in laboratories, 857 deaths. Now, this is the total epidemic in Mexico this year. This is what we've had so far. Now, on the next slide, we can see that this focus is the same as we were talking about yesterday. We have a focus in Mexico that is representing active pandemic in Mexico. We have distribution of these 3,185 cases over all throughout Mexico. And basically, we can see what the total load of the disease is. We can also follow up more closely and follow up on active cases and see exactly what's going on in each state. And this is based on what is shown in this map. We can also see that there is a risk that transmission will continue, that it will disperse into other entities where it isn't as present as it is right now. And this depends on social activities and people staying at home. Now, on our next slide, you can see the distribution of those cases. Here you can see the number of cases. This helps us to understand the distribution by state. This is similar to the map, but we have a different presentation for you so that you can see the information in a different format. These are the last 14 days distributed over all of Mexico. Next slide, please. Here you can see the incidence rate. Now, this incidence rate is per 100,000 inhabitants. We've adjusted it to the 3,185 cases that we had confirmed, the 3,185 active confirmed cases. Now, this contrasts a little bit with the first map because it shows us different color density, with the darker color being where the disease is more prevalent, where there are more cases, and lighter colors where there isn't there aren't as many confirmed cases. So this is because of the population density, of course, in each state. But this also helps us to really understand where is recent dispersion happening. Now, even if the whole state is not completely filled in with color, we can understand that within each state, where is the transmission concentrated? Is it in the whole state, or is it concentrated in one of its highest population municipalities, for example? On the next slide, we have the same rate as the other slide, but here you can see it again in a different format. There's a lower incidence rate in some states, and so you can see here where recent activity is happening. Next slide, please. This is the cumulative load of those 3,185 cases. How do they accumulate? How are they behaving over the last couple of weeks? You can see how, as time goes on, of course, logically, we have a higher cumulative load because of recent transmission. For example, in the last couple of days, well, I mean, there aren't that many active cases, but that's just because it's over the last couple of days. This disease is still, the virus is still transmitting among the population. Here we're taking a look at the deaths, the very unfortunate 857 deaths. We can see how the higher percentage is in men, 69%. Basically, since this all started, it's been the same, about 70% men affected. We can also see the distribution by age. We can see between the 50s how men and women are affected. This helps us identify where the most deaths are happening. We also want to know who is it's happening to more. You can see the blue bars are the men. You can see the proportion is quite high, that it's affecting men more. And we also want to know exactly in what age group. Now, the average age has been 59 years. So we can see this clearly here. Thank you. Here we have deaths distributed by date. This is the date the death happened. We also have a complement to that blue bar, this yellow part. This represents suspect deaths. That's to say, at the cutoff time for the database information, we didn't have confirmation that those were confirmed COVID cases, but the blue bar does represent the confirmed COVID cases. So you can see that there have been fewer confirmed, but as we get the rulings or the judgments or the confirmation for those cases, then we will change that yellow bar to blue. Here we have distribution of deaths by confirmed and suspect. And this is also by state where the death occurred. Here we can see which states are having an increase in the number of deaths. You can see the yellow bar here that is, again, the suspect deaths that have not been confirmed. This is our positivity rate. You can see that between the 11th and 13th of April, the positivity rate has gone above 30%. We're about at 33% positivity rate right now. That's a third of all suspect cases. So a third of all those suspect cases are COVID. And we were talking about that a couple of weeks ago when it was about 15 or 20%. But over the last couple of days, we can see how that positivity has been going down. But if we also do compare this graph to the other ones, we can see this increasing line could continue with that same trend, or it could continue to increase as we had thought. So we see now that we're at that peak of 33%. That is in a pretty significant increase. Next slide, please. This is distribution of confirmed cases, 9,501, and the cases that are up to today, which are 8,262, which are waiting for a diagnosis. Now, we've seen that there has been more accumulation in the last couple of days. We have to remember with that blue line, that's representing the cases by when they were registered. The registration date is when that person was sent to get medical attention. Now, this is classified as having fulfilled the symptoms. And so we're notified, and that is registered. And that's the date that we have as indicating when their symptoms started. So if that tendency continues to go up, that is telling us a lot. Maybe they weren't registered, they didn't register themselves to get medical attention on the exact day that their symptoms started. Maybe their symptoms started 5 days ago. But we can see how the suspect cases, even without having sought medical attention, are still registered on here because they registered their symptoms, even though they didn't need to be hospitalized. So, this date of when people registered their symptoms helps us to see how the data is performing in terms of the last week. So, for example, if we have a sample from today in the morning or from yesterday, we're still having the results on our graph. So that's something, this is information data that we're also going to be updating. There's more information that we can obtain from this graph. When we see the confirmed cases along with the suspect cases, then if we aren't actually thinking about the differences in the bars from their colors, but if we're looking at the whole bar in itself, we can understand the trend and where it's headed. We can see that some of these people have an acute respiratory problem and that they are going to get medical attention. We're going to see if they're at that point they're a suspect case, and we're going to see if it's confirmed to have been COVID because all the information is being put into our database. Let's go to the next slide. This is the slide show updated every day. This is the epidemiological graph. You can see the incidence. We have 729 new cases by the cutoff today. And we can see how this behaves in terms of the information from yesterday. Today it's 9,501. If we look at those orange bars at the bottom, we can see that there are fewer confirmed cases. But again, we do have those 729 new confirmed cases. See exactly how that behaves with the information from the last 3 to 4 days. And we can also see what deaths are confirmed and how that behaves with that information. Thank you so much, Dr. Head of Epidemiology. Now, could you speak to us now about the new tool? Oh, thank you, Doctor. Good afternoon. Hello, everyone. Everyone at home and also here at the National Palace. One of our main communication tools that we've currently been using is WhatsApp. Starting today, we're going to be able to send a WhatsApp to Susanna Safe Distance. This is an application and its goal is to give people information in a simple, direct, accessible, and free way. This is so that people can get more information, get it quickly, and understand coronavirus. It's very simple. We want to inform people and their questions about COVID. We want to tell them about symptoms. We want to tell them about action, follow up on, and we want to tell them how to work with this application, with this chatbot. This is to have a direct contact with people. And since so many people use WhatsApp, this is a great way to reach them. It's great to have these updated and immediate answers. What does this mean? That means that we're working with Facebook and they're the company that owns WhatsApp. So what we can do is be updating this chatbot according to what people need, according to the questions that pose in others on other social media or by email. We can update information on this chatbot. Now, it's important to understand that since this is a robot that answers questions, it's following a script. So it's available 24 hours per day. Next slide, please. We have the contact for Susanna Safe Distance, and she just says, hi. And when we send a message with hi, we're going to see this menu right away. This is the start menu for the chatbot. And here that it says, I am the official channel of the government of Mexico, and I am going to give you the best information for you and your family so that you can take care of yourself during COVID. So, for example, if I press option number 1, it's going to automatically take me to this screen. What is the virus and how is it transmitted? It shows an image where you can literally see how it's transmitted, how COVID is transmitted, just like Dr. Gatel Achu has shown us here. If we sneeze like that, we can see the little droplets, the saliva droplets that fall onto other healthy people, maybe on their eyes, on their mouth, and then it starts to incubate. So this information is updated all the time. Right now we have 6 different options, but we're going to be updating those the days go by. The first option, option 0, this is a triage area where Susanna is going to ask people, they're going to ask the user or someone from their family, they're going to say, do you have symptoms? The bot could ask a little more about the symptoms, little question and answer dialogue going on, and they ask, are you in an at-risk group? Can you stay at home? Or the bot could say, according to what you're telling me, this sounds serious, please call 911 and seek medical attention right away. These are the type of interactions and communication that people can have with the bot. If you have a question about COVID, you can send the bot a question. So if you're at home right now, you can take a picture of this QR code and you can download her contact and get answers from her. You can start to interact with the bot. So scan the QR code, write hello, ask a question. She's going to tell you to stay at home. That's what it says on this right now. Call her 5586-3385-89. Thank you so much. Thank you, Dr. Ricardo Cortés. Let's go to questions and answers. Okay, and you two over first. Good afternoon. Oh, yes, there are so many questions. Good afternoon, Angeles Cruz. I would like to ask you, how has the modality for presenting the data, because we sort of lost the outpatient and intubated patients numbers. I mean, I think we really like those numbers. Could you help us out with that and let us know how hospitals are doing and how full they are right now? That would be great if you could let us know what's going on. Could you give us that information, especially about beds for critical patients? Tell us information about new ventilators, about how many you have, okay? And then the other is to tell us how are the patients distributed within the hospitals, whether they're inpatients, outpatients, etc. And also, could you tell us that by region? Could you please specifically include the northern border area? I mean, what has been going on the last couple of days? I mean, you tell me, sir. I'm very worried. This seems very worrisome because we don't know what's going to be going on in the next couple of days. So in Mexico City, if we're worried about the limit for hospitals, Mexico City, how is availability in Tijuana? What is availability for hospital beds in the northern part of Mexico? What's going on in intensive therapy? Please, I would like to know what's going on with that. Also, it seems that in the incidence rate, what's going on with Tabasco, the state of Tabasco? It's in second place now for incidence cases, and it was represented by active cases before. So could you please make a comment on that? Could you please comment? If you could also include information about the number of municipalities where there is transmission, it kept going up and up. You had an indicator for that, and now I'm not seeing that. I really want to see information for the northern border. Also, that reconversion for hospitals, the retrofitting, could you let me know what is the goal there? Okay, there are many questions. Let me answer two. Angeles, you're very smart about this. No, precisely today in the morning, we announced the initiation of phase 3. Phase 3 means a change in how we're tackling this whole strategy. It doesn't mean we're changing it. It's saying that we're going to the next phase. So we had a transition from phase 1 to phase 2, and our strategy changed. One of the ways that it changed was in epidemiological surveillance. Let's remember that when we moved from phase 1 to phase 2, we activated our vigilance, our surveillance model. But we also incorporated more surveillance. Now, Mexico is one of three countries that was selected by WHO through the Pan American Health Association to be a pilot program for surveillance for this epidemic, this pandemic. Now, this doesn't mean that we are stopping that monitoring, we're stopping that surveillance. It doesn't mean that. It doesn't mean that we're not stopping to look at which suspect cases, that we're not monitoring that. That doesn't mean that. We've also been very clear that this monitoring for cases that aren't as serious is what is happening at the 475 hospitals where we're now more focused on deaths and very serious cases because we had more than 26,000 units at those hospitals. So we did add an extra level of surveillance there. Now, for phase three, we're also going to be adding another part to our strategy. We're going to have a special interest item that we're going to add. I'm just like you were pointing out, the emphasis now is how full are the hospitals? The characteristics, the clinical characteristics, the geographic distribution, the risk groups, all of that. Now, the crucial element that is defining for risk in phase three is to see how much access people are going to have to hospitals because they're going to be full. The first is a legal framework. Now, in a couple of minutes, they haven't let me know that anything has happened yet. We're going to have the night edition of the Federal Gazette of the Federation, the official Gazette of the Federation. Dr. Jorge Alcocer, the Secretary of Health, is going to talk about what the council people approved yesterday. Now, there's going to be an obligatory notification point there so that people exactly know how full the hospitals are by state. So the legal framework for that is coming tonight. We can't get ahead of ourselves on that, but that's going to be official and it's going to be coming out tonight. Now, the other item is the organization of different areas in the country. Now we have 10 days to efficiently cover with federal support to different areas where there's higher rate of transmission. We're going to have coordinators who are supporting this element that they're going to be supporting our national health system beyond how it usually gets support. And we're also going to be having them to help retrofit the hospitals and help them work beyond the capacities that they might have had. So we also are going to have a coordinator of coordinators. And of course, we really appreciate how the private sector has been working with us as well. We talked with them again this morning. These types of actions go beyond what the health sector is itself or capable of. In different areas, there's a practice where notifications are not just for each state. Traditionally, in epidemiological surveillance, states were letting each other know what was going on, but now we're going to be doing that by region. So the clearest example is the Valley of Mexico metropolitan region. That region has been proposed so that it take that role of coordinating and work with Governor Del Mazo to be the first model for coordination. So that's the first information that we give each day anyway, the metropolitan zone facts and data. So all of this, we're working on it very closely right now. Now, we have been working on pilot projects for a couple of days now in terms of deaths and stable information. And when we have that information, we're going to give it to you. If we go back even 24 hours or we get behind even 24 hours, the information changes so much and that causes confusion. Mm, no, not for this element, not for the epidemiological surveillance. We did a pilot project, and so that's how we worked on that. No, we do know, but not with a very efficient mechanism. It was efficient for phase two, but it wasn't efficient to go into phase three. So that's why we need to use the correct information and the correct strategy, this platform, for phase three, so that all of the states are getting notified. Yes, Tabasco, I'm going to ask her Dr. Alomia to do that. Yes.
Claro. De hecho, comentar que precisamente la transmisión, pues
Yeah, so basically the transmission is the one that is being manifested, meaning all of the cases that have happened during the past 2 weeks. By analyzing this data,
los productos de información a las últimas 2 semanas, que es donde se tienen los casos activos. Y
well,
efectivamente,
the active cases are
vemos que
the cases that
federativa, como sería
have been active, that have manifested themselves for the past 2 weeks. And for example, if we see a state such as Tabasco, if it has a darker color, it means their cumulative incidence rate is more visible than that of other states. That means they have a more active transmission during the past 2 weeks. All of this data can be accessed through the official website and is being updated every day. And the objective of updating this information and presenting it in different colors and different color variations is to be able to analyze and to reinforce the actions that we are adopting as part of the massive mitigation measures in different regions as they need them. Because if I'm observing that in this municipality or this state I have a higher transmission during the past 2 weeks than other municipalities, then I probably have to investigate whether these measures are being applied and they are being abided by, and I probably need to modify the strategy in that specific area to make sure these measures are actually complied with. And as a result, I could mitigate the transmission, and then this data of the cumulative incidents rate could either stabilize or begin to decrease, because this rate can move if as we move forward with this 14-day period that we are taking as a time frame, we can make this rate decrease. This is different to the total number cases, because those ones will continue to go up and up, up and up, and they will continue to increase. All of these data can be downloaded from the official website, and there you can get to know all of the cases that have happened so far. In the case, for example, of the northwest region of the country, I'm talking about Baja California Norte, Baja California Sur, we had observed since before that they were the first states, one of the first states that have had an important burden of disease and an important cumulative incidence rate. They had always been leading the way in this regard. Specifically Baja California and specifically Tijuana, and this could be representative of other municipalities in the north, they have a high rate of activity as compared to their counterparts in the United States. Actually, the municipality of Tijuana and the county of San Diego, the area of San Diego, they have high levels of interaction. So, of course, this increases the risk because, as you know, the amount of cases was, the number of cases was more visible before in the United States, and then this could have caused that as a counter effect, the state of Baja California and specifically Tijuana uh, showed some important increases in their transmission rate because of how close they are to the border. So that is the function of this map, to show everyone what is the relation per state and per region, what is between the different increases or decreases of the transmission rate. Nothing disappears. That's why we are using all of these public access platforms, and they are accessible to the public in the coronavirus website. Everything, all of the information is integrated. We have the maps, the interactive maps for the visualization of the municipalities that display exactly the exact number of cases in each municipality. We also have the overall total databases that are without any filters, so they can be used by whoever has the capacity to use them and analyze them. But now we are presenting a change of focus. So all of the information that we have been provided before continues to be accessible to the public. But we are having a change in the strategy of presenting it to the public now because we want to make use of the limited time we have here. I also want to talk about two things. The first is today we have the meeting, and this was the third meeting. The third week we have this meeting with the different secretaries of health in each state, the state secretaries of health. We had talked about, and this might be a matter of terminology, but it is important to clarify. We had talked about the different stages as different scenarios, and we were referring to scenarios because to emphasize their qualities as different possible scenarios. I mean, they didn't necessarily come one after the other. We could have gone from phase 1 directly to phase 3, but that fortunately didn't happen. And I think the media's were we had been saying scenarios, but then the media apparently started saying phases or stages, and then we started saying phases or stages, but it's the same. It's the same. Basically, there are different kinds of moments for the development of the pandemic, and for all intents and purposes, we can use either of those words, phase or stage or scenario. But let's not confuse with the technical terminology we use when referring to the hospital reconversion program, because let's not conflate the two terms. It's not the same when talking about phases of the hospital reconversion program as talking about phases of the epidemic. They don't have anything to do with each other necessarily. Also, I had to answer a question recently about a post by a journalist who asked me this question regarding the discrepancy between the federal data and the state data. And she showed me two examples. One of them was the Baja California case. And I limited my response to this case, the Baja California case, because I explained yesterday that the problem was that the state authorities didn't load the full data in due time. This was a mistake, and it happens sometimes. And it originated at the state level. But I didn't talk about the Tamaulipas case. And I want to make very clear that I am not prejudiced in any way, and I didn't have evidence that Tamaulipas state government was committing an error, so I didn't want to talk about it. And the state authorities over there are fully committed to the well-being of the people, and I know they work very well. But then, talking to them, we identified an element that explains the discrepancy, and this element is the collaboration of private laboratories. I want to make this clarification because this is part of the transition process from phase 2 to phase 3. Remember, in the beginning we wanted to decentralize the diagnosis, and we opened the collaboration to even private sector hospitals, private sectors laboratories, because we wanted to open the door for anyone who wanted to run tests, as long as those tests were competent. And we made some comparisons between the PCR test and we made some comparative evaluation to rate the effectiveness of these tests and the efficiency of these labs. Now we have a number of evaluated laboratories out of that have been evaluated so far and certified by the authority, and 30% of these evaluated and certified authorities are private laboratories. So the discrepancy reason is this. In Tamaulipas, we have private laboratories that produce data and then they incorporate it to the federal data, because and this data is minimum data, because this is the data we were interested in the beginning: how many confirmed, how many denied, how many suspect, etc. Now we're gonna change the modality, and the private laboratories are gonna also have the obligation to register nominally their cases. So those laboratories that are private laboratories and are going to be helping as auxiliaries in this process are also going to have to have a more complete set of data to notify to the authorities. And the third is not a clarification, but it's a congratulation. The state of Chihuahua, Mr. Governor, made a decision that I see as a very strategic decision, which was to create the under Ministry of Prevention and Protection of Health. We want to congratulate and we want to commend the work of Mr. Governor for this idea, but also to the person who is Dr. Mirna Florencia Beltran, who is gonna be the first Deputy Secretary of Health and Protection of Promotion and Protection of Health in the state of Chihuahua. She's a marvelous professional, very competent. She was originally a general nurse, then she became a surgeon, and she has had a wide array of public charges in the past. Thank you. Good evening, everyone. Bianca Aguirre from Notimex. Doctor, a few days ago, the President of Mexico, Andrés Manuel López Obrador, said that the worst moment of the pandemic would be the 2nd to 8th of May. Today, Esteban Moctezuma, the Secretary of Education, said that on June the 1st, all kids are going back to school. Don't you think these going back to school dates are very premature? Thank you for the question. This is useful to give at least two messages. First of all, this very morning when we were talking about this, we had the same question asked to us. I think it is a legitimate question. Whether we are or not near the peak of the pandemic. The second question is, when is it better to go back to our activities, considering elements that we have been observing since the very beginning, which is the balance of the balance between protecting the health and the life of people, because they could get infected, they could even get sick, and they could even die. So this is our priority. This is why we implemented these mitigation measures, this safe distance program, and they have mixed results in the way that they have a positive effect on taking care of the health of the citizens, but also there can be an impact on the economic life and the social life. Because of the massive character of this intervention, these effects are also massive. They are an economic in nature. We have been very clear in our intention to not to protect the owners of wealth, but we understand that the generation of wealth in a country increases the possibility of a country to be economically viable. But also we understand that half of our population lives in very challenging conditions. This fact has been documented by many national and international institutions over the last few decades. So, of course, suspending mobility in the public space, which is the core mechanism of these measures, these people who account for half of the population, they find themselves at great difficulty because they cannot go out to work, they cannot continue to have the income that allows them to exist. So because of these reasons, the measures have a limit. We cannot extend them indefinitely because this can endanger the well-being. For other reasons, this could endanger the well-being of people and the well-being of our nation. Now, where is that limit? This limit has to be analyzed dynamically, meaning day after day after day, depending on the situation of the pandemic development and of the economic situation of the country. We decided, based on the recommendations advanced by the different scientific groups, whose members come from very high academic institutions in our country, including CONACYT, they all agreed on a prediction of what is happening in Mexico and what could continue to happen if and only if the massive mitigation measures are abided by properly. If this national safe distance program and these measures are not complied with, because people start to believe that we are coming out of the pandemic, or that it is not important to abide by them anymore, if they don't comply with them, then we're going to have a huge problem on the economic front and on the health front. So we need discipline. We'll say it again today. Stay at home. Stay at home. This is much necessary to reduce contagion. Now, the dates that we have planned so far is June the 1st, because it is important to give our population a reference point. But we still need to continue to evaluate. The case could come in which we need to extend again these dates. Spain did it, Italy did it, Portugal did it, so let's see that that is not the case. Thank you. Two questions, very briefly. First of all, this thing that you just said, stay at home. In our country, what percentage of the population is actually listening to you? And I would like you to address the nation again, because if we are already in phase 3, as it was stated this morning, why are we afraid of having a saturation of the health system if people really are really staying home? If it's only a very small percentage of people, the ones that are actually going out to work every day because they have a very urgent economic necessity. And the following question is, we have a saying here in Mexico, which is, you cover the well after the kid has drowned. So why is this app coming out just now? This app that can be very good for a lot of people. How long did it take you to develop this app, and why are you launching it right now when it could have been launched during the first phase, as you were aware of what was happening in Europe and in China? Why Mexico took so long to develop and launch this app? And lastly, we've heard about the hospital, the occupation in different hospitals, but I would like to know the specific information about which hospitals have COVID-19 patients nationally. Not talking about the occupation, but what is the list of the hospitals that have COVID patients? Right. First of all, the list is fixed and they are the designated COVID hospitals. That is the term we're using to refer to them. The federal authorities, but also the state authorities, selected which hospitals were the ones that were going to treat COVID patients, and they deemed them COVID hospitals, and they set them apart from the non-COVID hospitals. This list will be public, of course, but it has to do with the hospital reconversion program. Now, the first question and the second question are related, and thank you for asking them together, because your second question is, why are we launching this app just now? This app in which Susana Safe Distance orients people regarding the risks and the many questions that they might have amidst this pandemic. Well, there is a phenomenon that has been described in the public health sector, and comes from social science, and it's called informational fatigue. If you present information to the public, this information will stay with the public for a certain amount of time because of the capacities of the individuals. If you say something to someone, you will retain it for a while and then eventually forget it. There are people who don't remember what was said to them yesterday or this morning. Maybe they can last a couple of weeks, but eventually they will let it go. We have competing attention as humans. We have competing attentions between all the different stimuli that is being presented to us. When we are presented with newer stimulus, we prioritize, and then we forget about some other stuff that we deem unimportant relatively. So we know about this phenomenon and we took it into account. Although we did launch some other interactive resources like the interactive maps in which you can find the different COVID hospitals, and they had been accessible to the public since we began phase 2. So to answer your question, we launched this app specifically because we wanted to do it as we move to phase 3. And talking about this public space mobility means going out to work, going to a park, and these activities are the ones that usually are the three leading causes for people to be out in the public space: school, work, and recreational activities. Now, as the Mexican health authorities start to implement the mitigation concept, and we are referring specifically to the structural factors of public mobility, meaning what are the life conditions that lead us to leave our homes. These are the three most important factors: work, school, and recreational activities. So, because we identify these factors, our measures are not, because these factors are structural, our measures are not directed to the individual. This happened in other countries like in Europe, and that's why they had more severe restrictions forbidding people from leaving their homes. And we didn't do this in Mexico. That wasn't our focus. We didn't address the individual. We addressed the structural reasons that make the individual leave their homes. So if an individual doesn't have to go to work, they don't have to go to school, and they cannot go out and have fun, then they simply don't go out. This is what was done in Mexico. And we had great success in the reduction of mobility in the public space, up to 80%, meaning that we have only at 20% of the people circulating in the public space. Now, this number has some variation among states and among different localities, but on average, we have a 60, a 67, a 77% of decrease in public mobility. So we only have 23% of people who are still circulating. Now, pay attention to the relation between the percentage of reduction of mobility and the transmission rate, the decrease in the transmission rate. We have monitored, and we had seen how this mobility has actually decreased. But this is very important because since we have had great success in decreasing the mobility and then decreasing the transmission rate, but if the mobility starts to go up again, then the transmission will start to go up again. We're having some technical difficulties. I apologize to whoever is watching. Oh, it's because of the rain. Raining. Well, I believe that's that. Rain has affected my internet connection. Now, Mr. Deputy Secretary has frozen. So, thank you for watching. This hadn't happened in 3 weeks, but it is happening now. Well, thanks for tuning in. We'll see you tomorrow.